biggest change, I think, has been in the materials and the material science and the engineering that has gone into the actual implants themselves. Originally, the stem of the implant would be cemented into place. The cup would be cemented into place. Today, we have a whole world of biometals, titanium alloys, and tantalum that are porous coated, and the bone grows into them. And so they really become integrated into the human body. It is just like the bionic man. These things grow in and are so solid. One of the big challenges in my world daily is getting these out when they have to come out. They're hard to get out because they're so completely integrated into the bone. The biggest and most important change, I think, has been in the bearing surface engineering, and the current best system is a ceramic head, very expensive, very highly evolved, articulating against a polyethylene or plastic liner that has also been heavily engineered over time, and we are now in about the 8th iteration of polyethylene formulation. This is a graph. It's a little busy, but this axis is the amount of wear, and this axis is, quote, wear cycles. Generally, it's a rough estimate or rough average, but each human, a basic American human, uses about 1 million cycles per year of normal life. That's not including running marathons, not including swimming on a regular basis. But for day-to-day, regular activities of daily living, about 1 million cycles a year per hip. So over the course of 5 years, this would be a typical simulation of wear. This upper curve was the earlier first formulation of polyethylene, and wear was pretty considerable compared to the iterations and the developments that have occurred to this one that we're using today. Even this one is about 3 years behind. The plastics that we're using now are even more developed than this. And when you retrieve these in patients who've been hit in car accidents or something, you can hardly even see that they're worn at all. The original machine marks are still present on the surface of the plastic. So the idea of wear has I hate to say it, but I really think it's been solved, or nearly solved at this time. A conventional hip replacement is performed removing the ball and part of the neck, reaming the cup, reaming down the shaft of the femur, and then implanting these 2 main implants into place. Here is a recent x-ray, this was just a couple weeks ago, of one of my patients with a modern, up-to-date 2010 model Lexus of hip replacements. Cup, there's a little space in here where the plastic is. The plastic, like cartilage, doesn't show up on the x-ray. And the reason for this stem is to really anchor this ball in a good solid area of bone. And this patient was up walking the day after surgery, like many of you have the experience of, and was out of the hospital in a couple of days.